Welcome back to the Breast Cancer Wellness Summit. Our next guest is not only a thriver, she is also a clinical psychologist and one of the founders of Save Our Cells, a local nonprofit organization that services breast cancer survivors. Through her work with Save Our Cells, Dr. Capel has touched more than 1,000 lives and continues to work tirelessly, empowering and supporting breast cancer survivors. Dr. Brown Capel, welcome to the Breast Cancer Wellness Summit. In your profession as a psychologist and your role as one of the founding members with Save Ourselves, a local nonprofit organization, you have touched so many of the lives of breast cancer patients, survivors, co-survivors. Cass, I am honored to have you here and to tap into your knowledge and experience in the world of breast cancer. Thank you.
Well, thank you so much, Edna. It's for me, it's an honor to be here, and I'm glad that our friendship has sustained the test of time. And yeah, happy to be here.
Yes, our friendship has sustained the test of time because of common interests. I'm going to say our passion and dedication
Yes.
to our communities. And so, again, it's an honor to have you here. Cass, as you have worked with breast cancer patients and breast cancer survivors in that community, what would you say the role of resilience plays in one's healing journey and that healing journey from the start of the beginning, the point of diagnosis, through moving beyond?
Resilience is very, very important. The issue is that not everyone knows they have that resilience, but they can discover that resilience and get in touch with their inner resilience after being with other breast cancer patients who have been there, done that. I've had one example that comes to mind is women coming into the metastatic group, which we call the other shoe group. I can go into that later if you want. With deer in the headlights, the fear exuding out of her pores, and because I don't know, she thought she was coming into a morgue waiting room to be with a group of women with stage 4 breast cancer, and it was so wonderful to see in that hour and a half period. She walked out of there with this pep in her step, making that like this yes motion as she was going out the door. And I have to say that just made my heart sing, because she went from having one foot in the grave to seeing that there is hope. And it's that kind of experience that will build resilience. It's not, some people are born with more resilience than others, but if you're on the low resilience side of things, you can build that up. And resilience is very important.
And would you say, Cass, that resilience builds on, let's say, successes? Resilience builds on gaining strength.
Yes.
Resilience builds on learning more about your diagnosis and feeling empowered to be able to overcome.
Yes, yes. Having that, having a sense of competence. And that's one of the drawbacks of breast cancer is we're given this huge diagnosis, and we have approximately 1 week to learn everything we can about breast cancer, because it's a foreign language, foreign land, and we have to get up to speed so that we can ask the intelligent questions and not just assume that that your case is like everyone else's. And so yeah, knowledge is power, and information is power, and that empowers us to make these wise decisions about our treatment. And that's one thing I like about breast cancer is many cases we make our treatment decisions with collaboratively with our treating physician. Some diagnoses, it's slam dunk. This one, well, it's a blessing and a curse. You have this choice. You can have a lumpectomy and radiation, or you can have a mastectomy, or you can have a bilateral mastectomy, and we have all these choices. And it's kind of a huge burden and opportunity both to be given those choices, because then
Yes.
there's what if I made the wrong choice? And that's where we build our resilience, is learning all we can.
Yep. And Cass, what Save Ourselves does, and Cass, what Save Ourselves does is, hold on. And Cass, what Save Ourselves does is it brings breast cancer survivors together.
Yes.
That sense of community and not feeling like you're alone and being able to tap into the experiences of others and the power of the group being able to lift and esteem and provide confidence for other survivors. How have you seen group, quote unquote, therapy just change the trajectory of someone's journey in their recovery?
That's a loaded question. And in a way, I think I already addressed that with just giving that one example
Mm-hmm.
of, the one woman that walked in during the headlights and walked out with this sense of empowerment. And what it does is it helps people that might be prone to feeling hopeless and why bother, as I said, one foot in the grave, to say, no,
Mm-hmm.
I want to live. And if that person chooses to live, how are they going to live? And how are they going to um, live in a very what's that word, meaningful way? I mean, having a breast cancer diagnosis often pushes us to look at what's the meaning of my life. If you think you only have 2 years left, how are you going to spend those 2 years? And living in accordance with our internal values, because a lot of people don't. We're busy taking care of other people, other things, and we kind of forget about who our true selves are. And with Save Ourselves, we can let that our true self unfold and then live in accordance to those values with the support of other people who've done that.
Yes.
Mhm.
Cass, can you just give me an example how, let's say, a new member of the group shows up and the group is collaborating and communicating, but you realize that a new member is somewhat reserved and possibly resistant to interacting with the group.
Mhm.
How do you break that ice and get that new member to begin to absorb and collaborate what's going on around them?
That's a very good question. It's mostly when someone's in an environment where there's loving kindness,
Mhm.
people are going to be more inclined to let their defenses down. But there are some people that will come in, arms crossed like this, and not say a whole lot. And it's so wonderful just with, and we don't, a person in my groups always has the choice to say pass. They don't want to talk. Okay.
Mhm. Mhm.
Usually our groups are so spontaneous. I had one group years ago, one person come into the stage 4 group. She came in late and our group was already in full swing. And finally, after a few minutes, this woman says, um, am I in the right group? Is this for breast cancer? And we all nodded, yeah. And then she says, is this for stage 4 breast cancer? And we all nodded, yeah. And she sits back and she's looking at everybody's face and going, like, we're all happy. We're all happy. We're talking. We're social. We're connected. And that, just watching us, how
Mhm.
the people with stage 4 breast cancer, but it could be any level really, but stage 4 really spells it out pretty loudly. It's like, wow, I can have a life, and it's really special. I mean, and so they see how the others are coping with this, and it's sort of like that we give them the courage to dare or deign to hope.
Mhm.
And I think it's just so powerful. But usually, in our groups, we tend to be uh, a warm, compassionate, uh, you know, we tend to treat each other with loving kindness, warmth, compassion, and so that sets its own tone.
Yeah.
And that's one thing why groups often do need to be professionally led, because every now and then we can get someone in there. I mean, I've had this happen, where well, wait a minute. You only had 4 positive notes. I had 23 positive notes. And
Mhm.
it's almost like, oh, wait a minute. We're not. So I had, so as a professional, I have to intervene there and say, it doesn't matter, because we've all had that experience of having the heart-wrenching diagnosis is you have breast cancer. And while it's true, someone with 23 positive nodes is going to have a likely to have, but not always, a poor prognosis. But this isn't the place where we do my cancer's better than yours. And so that's why you have to have a professionally skilled uh, therapist in there, because every now and then, it doesn't happen too often, but it does happen.
I
I
understand. So,
yeah, it only
so I
happens
just want to
once.
make sure we understand, like, just breaking down those barriers to resistance. Now, we were just talking about the groups.
Yes.
Now, how would you begin the 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 work and the collaborative work with a one-on-one patient?
Well, it's I do that every day.
Hmm. Hmm.
I have people come in here for therapy, and because their wife or their husband made them come in, and it's like, yeah,
Right.
what are you gonna do for me, like that,
Hmm. Hmm.
and
Hmm.
so it's usually warmth, respect, compassion,
Hmm.
and reading their nonverbals. And if they look really well defended like this, as a psychologist, I'll keep it light, because I don't want more barriers to go up. I mean, this isn't the time. This is not when I say, well, I understand you've had trauma. Do you want to talk about that? We're not going to do that in the first 5 minutes of a conversation, right?
Hmm. Hmm.
So it's like, I call it walking beside them. It's just, joining with them.
Hmm.
Look for commonalities between myself and them. It could be something about, they have a certain kind of jewelry, or so just to do anything to connect with them. See,
Yes. Yes.
and I do, when I have to. There's a thing, I work in an agency, and I have to do all the disclosures around confidentiality and mandated reporting. So
Hmm.
I kind of add some humor in it, and humor helps a lot. So um, like, elder abuse starts at age 65. I said 64 is okay, but 65 is reportable. So I use some humor just to help lighten
Hmm.
things up a little bit.
Hmm.
So,
And would
so
you
I,
say that some of the, or no, and would you say that the biggest underlying reason for some of the resistance, some of the distance is fear?
yes,
And
absolutely.
yes, and how do you address the fear? And I'm going to speak from a psychological point of view, right?
Hmm.
Not just, leveraging the groups and the humor and the trust factor, but how do you get someone to begin to confront that fear and begin to see that fear dissipate in them?
Very good question. And
Hmm.
again, it's like, there's ways to hold people.
Hmm.
So, by making eye contact, or if they don't make good eye contact, then guess what?
Hmm.
I'll lower my eyes. I won't look
Hmm.
right at them. So I follow their cue. When I can, sometimes I'll match my breathing to their breathing. I make sure, I have a computer here. This is not the time I'll be shifting. Uh-huh, uh-huh. This does not make someone feel like they're hurt, right?
Right.
So, and it involves all of us, so to have, all of our beings. So to have an open stance, so they can feel psychologically held. I've had
Hmm.
situations where someone will look me right in the eyes and tell me, actually, this is a true story, uh, just looking at me and saying, this isn't a patient, this is another graduate student friend of mine. It must be so scary dealing with this
Hmm.
disease. and just that complete understanding. Suddenly I could feel my defenses
Mhm.
collapse. Just
Mhm.
someone could empathize with the fear that I was dealing with. And that was so, and she didn't touch me, but I felt so whole. Because a lot
Mhm.
of times what happens is people who are newly diagnosed, they have some well-meaning friends around them, and they'll say, "Oh, I'm sure you're going to be okay." Nobody knows how if we're going to be okay or not, right? And so when someone says, "Oh, I'm sure you're going to be okay," what that does is essentially it tells the patient to put their fear, to stuff their fear and not feel their fear because they shouldn't, because this person says I'm sure you're going to feel okay. So it's invalidating their feelings, if that makes sense. So to
Oh.
have that, yeah.
Mhm. And Cass, I am so happy that you brought me back to the point, the fact that you too are a breast cancer survivor. And I have just been really focused on your professional work and how you've changed other people's lives. And
Hmm.
let's just talk about you for a moment and your journey. Cass, do
Hmm.
you mind sharing with the viewers and the audience, you know, when you were diagnosed, how you moved through your process, and the final part of that is that a lot of what led to what you do professionally?
Well, um, good question. And actually, I was in a doctoral program before I was diagnosed. I mean, I know it had always been in my cards to be a psychologist. From when
Mhm.
I was 12 years old, I vowed to myself that someday I'll be that person who can be there for others who have no one to be there for them, because that's
Mhm.
my experience. Um, but when I was diagnosed, I felt, I had some of that disbelief. I was 32 years old, but I could
Mhm.
feel this lump growing. But when I finally got the news that when the doctor finally called back and said, well, he didn't say I had cancer. I had a mass. He wouldn't say
Mhm.
the word cancer. Um, I thought, you know what? My name was Catherine Brown at the time. My maiden name is Brown, and just think, Kathy Brown. Pretty. I went into denial. I said, you know what? I bet you Kaiser switched the slides. There's
Mhm.
1,000 of us, because really, how do you get breast cancer at 32 years old? So I went through that whole denial thing. Never mind that I could feel the lump growing up here. It felt like someone had inserted the end of a pencil, and it was on the top part of my breast. It was way up here. I still
Mhm.
feel where it hurts. So it was a process, and I felt very alone in the process, and that's probably how I Save Ourselves eventually came into being. I mean, not just me, but there were several of us.
Mhm.
Um, but I had to get a lot of information, and then this first surgeon I saw, he said something that absolutely was not okay with me, and I just switched surgeons, switched Kaiser facilities, and I'm not trying to dog Kaiser here. It just happens to be where I went,
Mhm.
and so it was a process getting this opinion and that opinion, and then I end up going to Stanford to get a second opinion from Stanford, because
Mhm.
I was afraid of making the wrong decision, right? And then
Right.
who do you go to? So, but what happened, and I don't know if this is where you want to hear how Save Ourselves got born or not. Um,
Certainly. Yes.
okay,
Yes.
well,
Yes. That's a
because
part of your journey, and it's a
okay,
impactful journey.
well, let me tell you that I had found one. Uh, I had found one support group through a cancer organization, and I went, and there are these two. I mean, this is what I would have said when I was 32, but I wouldn't certainly say it now, since I'm probably older than those women. But there are these two old biddies, and they're, oh, with I'm so sorry for sounding like this, but oh, you you poor thing, and I just I couldn't deal with that pity, and maybe
Mhm.
because seeing that in their eyes, there's two of them and one of me, and that sense, maybe the enormity of how awful it was for a 32-year-old to have breast cancer. Because back
Mhm.
then, my odds of getting breast cancer, according to the Why Me national stats, were about 1 in 2,300. Because Why Me used to post all these stats. So that I couldn't go back to them, obviously. So what happened is a group of young women. We sort of networked. I had gone to the YWCA. Wasn't Reach to Recovery. It was the thing where you do the swimming exercises, and I'm
Mhm.
blanking on the name of it now. I'm so sorry. And so we just connected, and then my surgeon actually gave me the number of someone else who was young. This is, I mean, HIPAA was always a law, but this is before anyone really honored it. So a bunch of us connected, and we would meet once a month at Red Lobster. And at first it was a small gathering, about 8, and then it grew, and then it grew, and then it grew, uh, and then the servers didn't want to do individual tabs, and um, so we ended up having, and it was sort of fun there because here we are at the restaurant. You say, you want to see, this is my scar. And then, oh, yeah, you want to see my, and,
Mhm.
there's a lot of this
Mhm.
going on in the restaurant, even in the bathrooms and stuff. So it was kind of fun. But we ended up having potlucks and on the fourth Wednesday of the month and, and at different people's homes. And that was great because after we'd eat, and after we'd shown everyone our prosthetic sort of lick and stick nipples and all this stuff, I should have brought them to this thing. They're these little round nipples that are plastic, and you can lick them and put them on top of your prosthesis because a lot of prostheses, they don't have much of a nipple. So
Right.
this way, or if you have reconstruction, you can put them on because reconstruction often doesn't involve 3D nipples. Anyway, so we we do that, and then
Mhm.
but we sit around and say, not enough's being done for breast cancer. Somebody should do something. And the next month, after we eat, and same thing, not enough's being done for breast cancer. Somebody should do something. And one time, one woman whose husband was a lobbyist said, I know we can follow. John's a lobbyist, John Goodman. He's a lobbyist. We can start following bills, breast cancer related bills, and start letter writing. Yeah, yeah. So we'd start doing that, and because way back when in the late '80s, ready for this? If you had let's say you have mastectomy, your insurance would cover for you to have a new implant put in, right?
Mhm.
But suppose
Mhm.
this other side is by this time a size 36 long down here. If you wanted to have symmetry, guess what? You had to pay for that to have this other breast
Mhm.
lifted. Insurance didn't
Right.
cover. So we got busy on legislation, that kind of legislation. And
Okay.
anyway, so then on our Christmas dinner, we decided to have it at the Spaghetti Factory over on Hazel and 50. And it was our group, it was about 8 of us. And in comes Ellen Hobbs and Kathy Ferris. Ellen Hobbs was about, at that time, 34 years old, bald from chemo, and Kathy Ferris. Kathy was being denied monoclonal antibodies by her healthcare provider, and Ellen was told that by 2 or 3 leading oncologists in the Sutter system that the only way to save her life, she had 20, I think 24 out of 25 positive notes, and 4 small children ranging from 5 to 12. And the head of Foundation Health Plan says we can't um, pay for your bone marrow transplant. And at that time, Sutter said that's the only thing that she could do, right, is have an autologous bone marrow transplant. And Foundation wasn't going to pay for it because it was considered experimental. So that was quite devastating. And that's when Ellen took out a permit. It never even crossed her mind that people wouldn't come. She took out a permit to have a rally against breast cancer, or it's really in support of breast cancer, on the West Capitol steps on Mother's Day, 1991. And so she had that permit. It just didn't cross her mind about how she's going to do this, but she was so mad she had to do something. So she comes to this our meeting with this idea, and she already had named the organization because she realized it was up to her to save herself and up to Kathy to save herself, that they named it Save Ourselves. So, and guess what? The acronym SOS, a call for help. And in the beginning, the O had the female sign, signifying female.
Mhm.
Um,
Mhm.
so it was perfect. So she named the organization, took out the permit, and we had our first meeting in January of '91 in her living room. It was a 2-story home in the Foothill Farms area, I guess, and people are all the way up the stairs. I mean, it was full. It was like 45 people in this living room, and we're all excited. And this one says, "Oh, I can write grants." Someone else says, "Well, I'm an editor. I can send things into the paper. I can edit things." And someone else said, my husband runs a copy shop, and
Mhm.
so altogether, it was just so excited. There was so much fire there. It was really riveting. And then there was a disagreement on how to handle certain one. So there's some political things that got in
I,
the way a little bit.
Cass, I just want to tell you that it is just it's so inspiring just to hear the story of how these women came together and corralled and stood their ground. And it's a remarkable story. And just to see the rippling effects of their impact and your ongoing work with Save Ourselves in the community, I mean, it is something inspiring. And so I really appreciate you taking the time to share that. And the thing is that there are, I'm certain, people who are listening and watching that are familiar with Save Ourselves, but never really knew that story. So
Mhm, mhm.
thank you, Cass. If you
Well,
had to guess,
mhm.
how many lives has Save Ourselves touched?
You know what? At one point, because we were receiving grants from Komen, and we had to keep track of everything. The last time I did it, it was over 1,000 people in our groups, but that doesn't count the people that came to our health fairs that stopped because we would, like La Familia would have a health fair. There'd be one in Oak Park. There'd be the UC Davis had their cancer survivor days on the first weekend in June. So we would have our tables because we wanted to expand outreach because there's a lot of people that are underserved. And so not counting all those health fairs, and we probably did at least 5 or 6 health fairs a year. I mean, easily, and not counting having a table at the Komen events and all that. So that thousand are those people that sat in the same room.
Mhm.
You know, I mean, easily over 1,000, but I can't because each for a while there I had 4 groups. Each group had 10 people in it. And there'd be little in and out traffic, but every 4 months, if someone went to bow out of a group, that's when they would bow out because it breaks up cohesiveness. If there's always some new person coming in week after week. So, so
That's an impact. And Cass, if there is one piece of advice or insight that you could share with a breast cancer survivor, maybe someone who's newly diagnosed, what would that insight or advice be?
well, first is never give up hope. Never give up hope. Never give up hope. I mean, I can't say that. There's so many. We've had women in our group come in where their oncologist says, "Well, you've got 2 months, you'll make it through Christmas, but you better get your affairs in order." That person lives 7 years.
Yes.
So the biggest one is never give up hope. And
Oh,
okay, so I would encourage them to get connected to a group. It doesn't have to be my group. And but ask the facilitator how, talk to the facilitator and say, how do you handle it when there's too many Debbie Downers in there? Because, you know, what I tell people in my groups is you can visit Pity City, but you can't buy real estate there because
there-
nothing will suck the life out of a group faster than someone that comes in week after week after week. Well, I don't know. And my husband this, and my daughter this, and my car this, and it just sucks the energy right out of a group. Okay.
sharing that, because I think that those words are powerful. I think that they are, they help people find their way. It gives
Yeah.
them direction. And
Mhm.
that's one of the things that someone who is newly diagnosed needs. Yeah, because we really, I mean, if I put myself back in the place of a newly diagnosed person, you don't know where to go. So your perspective, your insight, your experience, and your wisdom has been greatly appreciated here, Cass. And I am certain that you have touched someone's life in a positive way here today. Thank you for being here.
Well, thank you so much, Edna. I appreciate you having this forum. I mean, anything to do to help the breast cancer community, this is one way, and I think it's important. And
Thank
so
you.
I'm so glad you asked me to be part of this.